We're already at chapter 4.
Yeah, it's moving a bit quicker.
So, welcome to Money Talks, the operation where something doesn't matter.
Hey,
Hey!
you there.
Hey.
Do you work here?
Who? Me?
I think this is the first time we've actually seen, like, the bottom of the outside of this building.
I think so.
Well, yes.
Could you please take a look at my son? He's been complaining of terrible stomach pain.
You brought him here? We don't accept emergencies or walk-ins.
I heard this hospital is famous. And it's so big. There must be someone who can help.
Well, there's no point arguing about it. I'll take a look at him. What's your son's name?
Oliver. Oliver McHale.
You wouldn't believe the patient I'm dealing with. He's throwing a fit because his operation isn't expensive enough.
Are you serious?
Yeah, his friend just had a hernia operation that cost $40,000, and he doesn't want to be outdone. He's 11 years old and filling the role of a trust fund brat perfectly. I guess it wasn't enough for him that his father pulled some strings to get him into this place. He's the son of some big shot, and neither of his parents have the time to bring him here.
So how much are we charging him?
About $30,000. The operation will be performed in a deluxe suite. Not bad for a case of appendicitis, huh?
Appendicitis? What a coincidence. I'm seeing a boy with the same condition.
Excuse me, Dr. Blaylock?
Yes, Elena?
I have a message from accounting. They say to transport your new patient somewhere else. It seems the family can't afford the treatment. Since Caduceus isn't normally open to the public, they don't know how to deal with situations like
I
this.
feel like something like this should have come up at least once in the past.
How much is it going to cost?
Well, the family doesn't have health insurance, so at least $10,000.
But transporting him now will put his life at risk.
Unfortunately, money talks, even when it comes to healthcare.
Hey, that's the name of this mission.
What do you
Title
think?
drop.
Should I have him transferred?
That's a tough decision. Marcus, have you given your patient his bill yet?
No, why?
Do you mind if I handle it? Chandler, Mr. Forbes, about your hospital bill. The total will be $30,000.
I told you, that's not enough. I can't lose to someone like Jimmy. His dad's just the president of some little company. I want a premium upgrade. Bring in like 10 doctors.
I'm afraid we can't do that. But there might be something else we can do. If you'd like to make a donation, we can increase your bill. How does $10,000 sound?
That's it? Well, how much would the total be?
Okay, so you take 30,000 and you add 10,000. Now, what's the answer?
That would bring it up to $40,000.
But that's the same as Jimmy's. That's still not high enough. I'm way richer than he is.
Well, we could add 2,000 more and make it 42,000.
42,000. Well, I guess that's okay. My daddy gives me whatever ow, my tummy hurts. Hurry up and fix it.
We have the best room reserved for you, so let's get started.
Well then, the donation will be transferred from the hospital to the Oliver McHale Fund. Elena, prep for surgery. We've got 2 appendixes to remove.
Pretty sneaky, Val. To be honest, I'm impressed.
It still counts as a donation, so it's not gonna cause us any problems, right?
It'll be fine. It's in both their best interests anyway, so it all works out.
Well, let's begin the conference. The first
be
patient,
some
Chandler,
paperwork
has
hell,
acute
but-
appendicitis. It appears to be in its early stages, so the operation should be fairly routine. However, the second patient, Oliver, seems to have the same condition, but in an advanced state.
Seems to be? You don't know this for certain?
It looks like he's been trying to hide his symptoms.
But he's only a child.
We understand the situation. This is going to be 2 operations back to back, so let's be quick. We're going to save them both, of course. Let's get started.
See, how much time do we actually get for this?
It was 5 minutes.
Okay. Well,
This boy's condition is
not to
relatively
understate
mild, isn't
this,
it?
but Chandler is very easy.
It's still too late to treat it with antibiotics. It would be best to perform an appendectomy.
All right.
And besides, antibiotics
begin
wouldn't cost
procedure.
$42,000.
No, they would not.
Please prepare to extract the appendix. First, inject the sedative. Next, we'll be cutting into the... Next, we'll tie 2 wires around the appendix. However, they must be tied in the appropriate places.
The game's actually not too picky. You just have to grab the tool and then just kind of pull.
One goes around. Look at what we're done tying.
Now that both parts of the appendix have been tied, make an incision between the 2 wires. Now that the appendix has been fix the membrane with the looks like the
I'm just
first
cutting her off.
operation was a
Let's fix the
success.
map.
Yeah, I ended up just kind of watching because it's just like,
Let's close
I'm
him
here.
up.
And the vitals aren't really even...
Look, it took us took me 20 seconds
Yeah.
That went smoothly.
to do
Tw-
that.
about
24.
23. No, closer to 23.
23.
Let's move on to our...
Doctor, we have a problem. Oliver's condition has
This
worsened.
one, you'll actually need to do some stuff for.
Okay.
What's his condition?
He complained of severe pain and then went into shock.
Don't tell me. His appendix has burst.
We'll find out when we open him up. We have to hurry and get in there.
That's unfortunate.
The pus is causing inflammation. Treat the inflammation and drain the pus.
Okay,
the
so you
appendix needs to
take
be
care of the
removed as
inflammation, so
well.
I'll take care
Begin
of
with the sedative.
or getting rid of the
blue?
appendix. Yeah.
This is bad.
Okay, you
The
can't
appendix
inject
is
if there's pus in the way, so stop if pus
Go somewhere else if there's pus.
goes
the
in
way.
front of where you're trying to inject it.
Damn it. I thought that one was far enough out of it. And the first one appeared
The
as I was
appendix
pressing the A
affixed.
button.
The synthetic membrane has been affixed. Let's treat the remaining wounds.
Right. That's a large one.
Oh, come on.
The appendectomy is complete and the peritonitis has been treated. Let's close him up.
Still, even between the two of them, it was only a minute.
This boy is very
Yeah.
weak.
Go for a
If he'd
minute.
waited any longer for surgery, he may not have pulled through. Well, let's close him up.
Rich or poor, we're all the same under the knife. I never thought such a simple operation could put me on edge like this.
I think we've all learned something from this operation.
And what were we supposed to learn from this operation?
Money talks.
I mean, I guess.
How much you bet that was like no misses?
Eh.
Still got an A.
Yeah.
Also, we ruined Scab again.
Damn it.
Thank you so much, Doctor. You saved my son's life, but I thought that this hospital didn't treat normal patients.
Well, it was an emergency, so this was a special case. Thankfully, an anonymous donor paid for your treatment fees.
I can't believe how fortunate we are. That donor must be an angel.
Not quite, but you know what? Just
Yeah.
we'll go with that.
Yes, well, please see to getting your son health insurance so he can get the medical help he needs.
Okay, I will. Thanks again.
You're welcome. Take care now.
You're very good with children, Dr. Blaylock.
Thanks.
I mean,
I did some volunteer
the
work
last
at
time we
home.
saw her interacting with a child, I was just sitting here thinking,
you, Marcus?
oh God, why
You
did
were the
you
lucky
say that? That's
beneficiaries
just
of
going to
your
make
time.
things worse.
I didn't do any volunteer work.
Really? I thought that was a requirement for all doctors.
Apparently not for him. Looks like we're getting into ska territory again.
Yeah.
Also, Weather Channel
He's
music.
so self-centered. Drives me crazy.
It's back.
Yeah.
I haven't heard from him in I don't know how long, and now he's telling me to come to Philadelphia. He's got some nerve. It's like he thinks we're still dating.
That's just his personality. It can't be helped. Besides, you already said yes, right? You're not on call, so why not? Think of it as a little vacation. A chance to reminisce about your college days.
I'd rather not.
How stupid of me. When I heard that he'd found a new type of parasite, I agreed to go without thinking. That reminds me. How are things between you and Ray?
There's sad face again, and double ellipses.
It
Oh,
ended when he went back home.
Does that technically count as 3? Since there were 2 and
Maybe.
then 1 in front of the
not
next?
3 at once, though.
I don't know if we'll ever see that,
Probably
unfortunately.
not.
Oh, sorry. I shouldn't have brought it up.
Oh, it's all right. If you're so worried about this trip, then why don't you bring Dr. Vaughn along?
I don't think he'd actually be too keen on
He
that.
has some time off too, doesn't he?
Yeah, but if she doesn't bring him
I don't
along, then
know
there
if
won't
that
be
would
any
such a good
surgeries.
idea. I'm sure he wants to get some rest.
I think he'd be interested in going. It sounds like a fascinating discovery.
You think so?
Thanks, but I'll pass. Philadelphia's too far. It'd be a waste of my vacation. Besides, Robert finished his report on stigma, and I'd like to review it.
Oh, come on. Don't be that way. This information will be useful for you.
Not really.
If it was that important, Caduceus would be all over it. The parasite isn't going to help us understand stigma any better. I have no interest in a new variety of hookworm.
You're going to drive all the way to Philadelphia?
That's the plan.
That sounds like fun. I haven't been on a road
No, it
trip in
doesn't.
a long time.
Yeah, it really doesn't.
Really? Then would you like to come along?
See, like, part of the reason why road trips are fun is because the destination is usually good.
Yeah.
Because you're heading for a fun or exciting place, and you also have fun along the way there. You know, that's what makes it a road trip.
Yeah.
Are you sure it's okay?
Of course. The more the merrier. I'll tell Denny it's a field trip for Caduceus Special Disease Counteraction Team.
Hey, I didn't say I was going.
What are you talking about? This is a team effort.
We'll drag you by your ear if we have to.
Yeah.
I won't
need
take
the
no
full
for an
team
answer.
for the inevitable
We're all going to
surgery.
Philadelphia.
Now, luckily for us, we actually skip the actual visit.
Oh.
We just get to hear about it.
That was an interesting operation, wasn't it?
I suppose. It would have been a lot more interesting, though, if the operation hadn't been performed on a dog.
Don't be so cranky, Marcus. How was I supposed to know that Denny decided to become a veterinarian? He tried to be a nice host, right? Even if he didn't exactly succeed.
Okay.
Look at that guy. He's driving like a maniac. I hope he gets pulled over.
Well, I thought it was worth the trip.
Really? Me too. I'm sure what we learned will come in handy someday.
It won't.
If we ever have to save a celebrity's pampered pooch, I never should have let you talk me into this.
All right, I'm sorry. I wasn't thinking straight. I mean, how would you feel if your college ex called you out of nowhere?
I don't even know if Marcus has a college ex
Yeah.
or not.
I totally understand. Just ignore him, Dr. Blaylock. Hey, what's with that police car?
There's been an accident. Stop the car.
Today's just not my day. It's worse than I thought. Someone was thrown from the car.
It seems he was the only one inside.
He's breathing, but he's unconscious. The wounds on his chest are pretty bad. He's not looking so great.
I brought a set of instruments. Let's get ready.
That's convenient. Did you
We're
bring
going
two?
to operate here?
We'll just perform first aid. He may be suffering from damage to his internal organs.
You know, it's first aid, but it's going to function exactly
This
like
has
any
turned
other
out to be
surgery.
one hell of a road
Yeah.
trip. This is an emergency. We have to stabilize him.
Using stabilizer.
Yep.
He appears to have sustained serious blunt trauma to the chest.
We need to treat these external wounds first.
We've treated his external wounds, but his vitals aren't stabilizing. There's probably
tried to
some internal
stabilize her.
bleeding. Please open him up.
When they say stabilizing there, they mean
No, I know.
they keep
I just think
going
it's
down.
funny.
This doesn't look good.
Please, use the antibiotic gel before the hemorrhaging worsens.
Oh, that's right. That's the one that's
That
A
was the
and B.
worst one.
Yeah.
That's why nothing was
Now.
happening.
Okay, you know what's interesting? I can't
magnification
actually treat that until you drop the piece on the tray.
Huh.
So the cut was there.
Well, I guess it's in case
You
I...
drop it.
But his vitals still
Yeah.
haven't
I guess that makes
stabilized.
sense.
Patient's vitals.
It's just weird from a...
The hemorrhaging. Doctor, something's
vitals.
wrong. Keep
Yeah.
poking.
I hate it
I'm
when
gonna run
like.
into the
The
cooldown
shadows
limit.
disappeared. Please use the
Can't do
ultrasound
vitals.
again.
Well, luckily I'm done with most of this stuff.
Yeah.
Oh boy, these.
Now suture
Okay.
these. There may be other pockets of blood.
Your
Keep searching.
syringe is back.
Oh, good.
There you are.
Finally, his vitals are stabilizing. He should be all right now.
All right.
Hooray!
Okay.
We saved the man.
Let's close him up.
Yay.
If we hadn't decided to operate, he never would have made it. Well done, you guys.
Woohoo!
Yay.
Now, it's a good thing for him that we went on this trip.
Yeah.
I'm done
Does
transferring.
scab with 2 A's count? Scab.
I don't think we can count that.
No, I don't think so.
Well, we at least accomplished something worthwhile on this trip.
Yeah, he's one lucky guy. How many officers can say they've received roadside surgery?
How many would want to? Hey, you know what else we could spell potentially? So if we get SAAB, we could spell the car/engine company Saab. Okay, well, that'll do it for this episode. So thank you very much for watching. I've been redxparasite,
I've been Air 327.
signing out.